Hello. So I'm doing my disease process paper over the neurovirus. And so what the neurovirus is, it's a virus that gets into the stomach and into the large intestines and causes gastritis, which is inflammation. And once you come in contact with the neurovirus, it takes the symptoms about 24 hours to get into your system, and then you start experiencing nausea, watery diarrhea, and vomiting. And so, how you contract this virus is it could be person to person contact, it could be touching a surface that is infested with the virus, it can be by eating raw vegetables and fruits, or by oysters or clams that haven't been cooked. Like I said, the symptoms are watery diarrhea, nausea, and forceful vomiting. And then the way that the doctor diagnoses the virus is by sometimes just symptoms alone. But if they're not for sure, then they will ask for a stool sample, and then they will test the stool for the neurovirus. The neurovirus's favorite places that I researched were daycares, healthcare facilities, and one of its best places that I seen was cruise ships. So I researched that there were about 11 cases in 2014 alone of the neurovirus, and one of them was a cruise ship where about 600 people were all sick from the neurovirus. They all had the same symptoms. Another way that I read that you can contract the neurovirus is airborne. So if you're in real close quarters with someone who may have contracted the virus and you're close to their vomit or you're close to the feces, then it could make you sick. I researched that one day. A group of people were at a restaurant and a lady vomited on the floor. Well, they did clean it up real quick, but the people who were in real close quarters, about 90% of them were sick just by airborne alone. They all had the same symptoms about 3 days later. A treatment for the neurovirus would be that the doctor he would not prescribe any antibiotics because it is a virus. And normally antibiotics are just for bacterials. So that wouldn't help out in the situation of the neurovirus. So what the doctor will prescribe is that you stay prescribe fluids, lots of fluids, because dehydration is a severe cause of this virus. And it's not really deadly, but in some cases, such as if you're elderly or if you have a compromised immune system, or younger patients like babies, they become severely dehydrated, and that's when the complications really kick in. Other than that, the symptoms will last for about 24 hours to 72 hours, and then after that, you should be clear. So prevention of the neurovirus would be hand washing. Just like every other thing, hand washing will keep down from you getting the virus. So washing really good with soap and water for those ABCs that all nurses learn, and wash your hands and say your ABCs, and that's how you know that 99% of the bacteria is cleaned off of your hands. Other things would be to wipe down the food prep areas with Lysol or with household bleaching water. Other things would be wash your fruit and your vegetables really, really good. And do not eat oysters or clams that have not been cooked. So, um, this is my presentation of the norovirus, and I hope you enjoyed. Thank you.